Hello, I'm Sergio Giralt. I'm the Melvin Berlin Family Chair in Myeloma Research. I'm a Deputy Division Head in the Division of Heme Malignancies at Memorial Sloan Kettering Cancer Center and a Professor of Medicine at Weill Cornell Medical College. I've been practicing bone marrow transplant and cell therapies for more than 30 years, and it's with great pleasure that I would want to give you a summary of what I thought was the best of ASH in these topics. I think I'm going to start with the myeloma part. The myeloma part had a couple of presentations which I think are very interesting in the context of the new drugs. The first presentation came from MD Anderson, and the second one actually came from Memorial Sloan Kettering. Both of these presentations looked at the impact of having myeloma cells as determined by next generation flow cytometry or next generation sequencing in the product that was infused after high dose melphalan. And both of them showed that having a contaminated product was associated with worse outcomes. Now, one would say that this is probably due to the fact that it's also a reflection of a lack of response. But it's interesting that some of these patients were MRD negative at the time of transplant, and they still had contamination in the product that was infused. So those two abstracts, I think, were very important. The other abstracts that I think were very important was a series of abstracts looking at the presence of clonal hematopoiesis in patients after autologous transplant for lymphoma. So the group at in the University of Alabama and in City of Hope looked at 1,300 patients with non-Hodgkin's lymphoma and 300 patients with Hodgkin's lymphoma who received a peripheral blood stem cell transplant. And using next-generation sequencing, we're able to identify clonal hematopoiesis in at least 33% of the patients. 1 out of 5 patients had one mutation, and 12% of the patients had greater than one mutation. And the patients who had greater than one mutation had a higher risk of late mortality due to a higher chance of developing second myeloid malignancies, either AML or MDS. Of particular relevance was the patients who had a p53 mutation had a much higher risk of developing a second myeloid malignancies. And we think the importance of this is that these patients need to be carefully followed. It was interesting for those of us who do transplant. The Italian group presented a randomized trial of patients getting a restricted diet versus patients getting a regular diet, with the exception of not allowing raw fish and raw meats. And the interesting thing, 224 patients were randomized, and the liberation of diet actually was not associated with their increase in neutropenic fevers, increase in diarrhea, or increase in any adverse events. And patients were much more happier, and their quality of life was significantly better by allowing them to have a more liberal diet. So I want to end up with the plenary session. The plenary session was extremely interesting. That was a randomized trial of patients with active disease. They had acute myelogenous leukemia who had still active disease after first induction or who actually relapsed. And the patients were randomized to what they call a remission induction strategy, which was cytarabine and mitoxantrone at high doses, and subsequently go to an allogeneic transplant, or a disease control arm in which patients would only be given relatively low doses of Ara-C or a single dose of mitoxantrone just to prevent the blast count from going up very high. So again, 281 patients were randomized, 183 because of lack of response to initial chemotherapy, and 98 patients after relapse. The median age was 61. Well, what's important here is that, again, there was no difference in overall survival or transplantation rates in either group. Now, this has to be taken with a caveat, because remember that in this group, 180 patients were simply that they had failed to achieve a CR to their first chemotherapy, and the standard practice for us would give them another remission induction chemotherapy. And the other thing that we don't know is how many patients were actually seen and were not offered this study. So there was some degree of patient selection, but it was surprising that the outcomes were similar for patients. And, obviously the patient, what we didn't get in detail was the tolerability and whether the toxicities of transplants were reduced in the group of patients who just had the disease control strategy. So with that, I think I've touched base with what I think are the most what I thought were the most impactful and interesting abstracts that were presented at ASH this year.